Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Sawing logs. It's not only a physical and risky job, it's also an appropriate analogy for snoring, and it can sometimes be as loud as a chainsaw and just as dangerous. Joining us today is Dr. Shamsul Hasan, board-certified internal medicine specialist at Fairmont Medical Center and sleep lab director at Fairmont Medical Center, and Dave McKnight, a patient who's been to the sleep lab in Fairmont. Thank you both for joining us today on Speaking of Health.
Thanks for having us.
Well, first off, I'll start with you, Dr. Hasan. What exactly is sleep apnea? Does it simply mean that you snore at night?
It's actually more than snoring. Sleep apnea means that somebody quits breathing in their sleep repetitiously to the point that the oxygen level goes down and the person wakes up frequently, not necessarily to the behavior level of knowing that they did wake up. So that's what sleep apnea is.
So is snoring a cause or a symptom of sleep apnea?
Snoring is associated with sleep apnea. So if somebody has problems of loud snoring, which is very disruptive, it's likely that person has sleep apnea syndrome.
So what exactly causes people to snore?
Snoring is the vibratory noise that's produced by the turbulent airflow in the narrowed airway due to the collapsibility of the upper airway muscles.
And are there other causes like being overweight, what you eat, that kind of thing too?
Yes, if somebody is overweight or somebody has inherently narrow upper airway, or if somebody smokes or has allergy problems, or if somebody drinks alcohol closer towards the bedtime, they have high risks of snoring. And again, these are also sometimes associated with sleep apnea syndrome.
And sleep apnea is actually stopping breathing while you're sleeping, which sounds extremely dangerous. What can happen?
It is. Sleep apnea means that upper airway muscles are collapsible to the point that somebody quit or stop breathing altogether before they wake up again, because the body's inherent system wakes the person up. And so what happens is that if somebody stops breathing repetitiously throughout the night, the oxygen level in the blood goes down, and that wakes somebody up. And it also, through complex mechanisms, causes damage to the arteries of the heart and the brain. So it is potentially very dangerous.
So actually, severe snoring at night can potentially cause heart attack, stroke?
Yes, if somebody has snoring, there's a high likelihood that person also has sleep apnea syndrome. So sleep apnea, the immediate effect of sleep apnea is excessive daytime sleepiness or fatigue the next day. So somebody who already had slept about 8 to 9 hours at night could have a fragmented and poor quality sleep. So the next day that person feels tired and sleepy. But over the long term, it causes damage to the arteries of the heart and brain, leading to heart attack and stroke, uncontrolled hypertension, irregular heart rhythm, and worsening of heart failure.
Severe stuff. Well, Dave, tell us a little bit about your story. How long ago, first of all, were you diagnosed with sleep apnea?
Well, in October of 2009, I had a heart attack. And when I was in the hospital, they told me that I wasn't getting enough oxygen when I slept, and that probably meant that I had sleep apnea.
So then you went to the sleep lab?
I went to a sleep lab here in Fairmont, and they definitely found that I did have sleep apnea. They've also found out that I had a different kind of sleep apnea than most people do. Mine was, I think, in the 10% range. And so then I had to go to Rochester and do it again because they needed to use a different type of technology on me.
So what symptoms were you having at that time, other than obviously the severe symptom of having a heart attack? But were you having other symptoms as well?
I was having a hard time sleeping. I was always tired. I want to take all these cat naps during the day. Just no energy.
And had snoring been a problem all of your life?
I've always snored a little bit. I don't snore real loud, which is, I think it's different for, it's different for each patient that has that. But I never did snore very loud, but I did snore. And then my wife tells me that I would stop breathing during the night.
And that puts up automatic red flags.
Right.
So when you went to the sleep lab in Fairmont, what was that experience like? What happened?
Well, it was quite interesting. You go in and they hook you up. They got all these things on your head and then on your chest, and it even goes down to your feet. And then you go into a room and they hook you up, and there's a camera that watches you, and they look for how many times you wake up in a night, and they take all the vital stats of what your heartbeat and I think brain activity and all different things, and then they watch that while you sleep.
And it's not just a hospital room; it actually looks like a bedroom. Right?
Yeah, it's right. It's a bedroom.
Mm-hmm. Dr. Hasan, what are some of the equipment that Dave's talking about that's used on the patient when they're in the sleep lab?
Yes, the sleep lab, the sleep study is basically it has two parts. The first part is the diagnostic part, and during the diagnostic part, the sleep is comprehensively monitored, quantitated, and qualified by the way of monitoring the brainwave and the monitoring of the eyeball movements, which help us to stage the sleep. Then the heart rhythm monitoring, and then it is found out how many times a person is breathing, quitting to breathe or breathing shallow to the point that the oxygen level is going down, how loud is the snoring, what are the abnormal movements of the limbs, etc. So there are about 7 or 8 parameters which are closely monitored. The second part of the study is called the therapeutic part, and if somebody is found to have significant remarkable sleep apnea syndrome, then CPAP titration is done. It's found out what is the airflow device's pressure that is optimum to keep the airway open so that the person breathes appropriately and adequately and doesn't drop oxygen in the night. And it also abolishes the snoring. So second part is for therapeutic purpose.
So Dave, after you were at the sleep lab in Fairmont and then at Mayo Clinic, you were prescribed an apparatus to help you sleep, right?
Right. And my apparatus it's a full face mask that goes on. And it also has you put water in it because it's got a humidifier in it, because it would, just dry you out so bad that if you didn't use it, the humidifier part of it would be uncomfortable.
So what has it been like since you've started using that?
I have a lot more energy. I don't take all those cat naps during the day. I go to sleep easier. I sleep longer.
And is it uncomfortable wearing it at all?
Not really. It does fit kind of tight because this one has to be able to not have very much leakage on it. It's not like the ones that you put on your nose, but not really. But I do sometimes wake up with it and it's not on, but I don't know if I hit it and it falls off or what.
And does it also make your sleep quieter?
Yes, it does. And that's one thing my wife says. I don't snore at all when I'm using that, and the only thing that wakes her up is if I get a kink in the hose and then the machine goes off and makes a real loud buzz.
So, Dr. Hasan, is there help for people who snore, and especially for those who suffer from sleep apnea? Is there help like what Dave had with the CPAP machine?
Yes, if somebody has problems of snoring and no sleep apnea, then the best strategy would be to try to lose weight, try to quit smoking, and one should not drink alcohol closer to the bedtime. And there's one thing we call the positional therapy, in which somebody can sleep on their side and not on the back. And there are some strategies like tennis ball t-shirt, etc., which can be adopted. And there are devices available in the market which can help you to stop snoring. But if it's sleep apnea, then treatment of snoring is not adequate. In that case, in addition to the conservative measures such as losing weight and trying to quit smoking, etc., somebody may have to use a CPAP machine or BiPAP machine, which by airflow would keep the airway open to the point that it would not collapse and occlude itself up during the sleep.
And how does the CPAP machine work?
It's just a mechanical airflow device. What happens is that the airflow keeps the upper airway open to the point that it does not collapse and stays open, so the oxygen level throughout the night stays steady, so somebody who has sleep apnea syndrome does not wake up frequently, and the sleep quality is tremendously enhanced.
So if you enhance that sleep quality, will that also improve your health? Will that lower your blood pressure and that kind of thing?
Sure, it would. The immediately perceivable benefits would be more energy, more wakefulness. But long term, it is just like any chronic disease. The risks of heart attack and stroke would go down. The control of diabetes would be better if somebody has it. And it would also help to control the blood pressure better. And it would reduce the chances or risks of heart failure and irregular heart rhythms, such as atrial fibrillation.
Dave, how are you feeling now? It's been almost a year since you got your CPAP, right?
Right.
How is your health overall?
A lot better. I've lost weight. I think I went from 235 down to 190 right now, and I just feel a lot better. Like I said, I've got more rest. I sleep at night. I have more energy to do things.
Dr. Hasan, you heard Dave's story. He actually had a heart attack, but had the sleep study, now has the CPAP machine. Does that decrease his risk now for having another heart attack?
Certainly it does. I mean, if he is using his CPAP machine regularly, then it is definitely modifying the risk factor.
So, Dr. Hasan, is sleep apnea, is it more common in older adults, or does age not matter, and also with gender?
It usually is. If people are older, they have a higher risk of sleep apnea syndrome. And it is also said that males are at higher risk of sleep apnea than females.
How about symptoms? A lot of folks get tired during the day, but is there a certain point where you should really seriously consider about coming into the sleep lab to have a sleep study done?
If anybody has sleep apnea syndrome, they may feel excessively sleepy during the daytime. He was mentioning about catnaps. That's how the burst somnolence or excessive daytime sleepiness would be characterized. Fatigue, undue fatigue, despite other examination being normal. Irritability, personality change, difficulty concentrating, and most dangerous is falling asleep behind the driving wheel. So these are the usual symptoms patients complain about.
And probably another big helper is your partner. If observing loud snoring, or like in Dave's case, his wife saying, observing him stopping breathing while he's sleeping, right?
Sure. Collateral history is very important here, because if somebody has sleep apnea, they wouldn't know much. It's their bed partner who would give us the most useful and important data, such as witnessed apnea or loud snoring.
How about the technology? Is the technology improving for patients with sleep apnea as we move forward in the future?
The sleep study itself is a very technology-intensive study. It's a very sophisticated study. And the interventional technology is also evolving and getting more user-friendly over the years. So people would be finding it easier to use over the next coming years. And they are already finding it easy and comfortable to use nowadays.
So Dave, overall, are you happy that you did the sleep study?
Oh, yes.
Has it been I'm assuming, a great improvement for your life?
Oh, yes, it has.
In what ways?
I'm able to do more. I can concentrate more on what I'm doing. The quality of my overall life is just a lot better.
And it was all something that you probably weren't even aware was happening?
No, I had no clue.
So, Dr. Hasan, how do you measure sleep apnea in a sleep study?
Sleep apnea is measured by the unit of AHI, that means apnea hypopnea index, and that helps us to measure how severe the sleep apnea is. If the AHI is between 5 to 14, that's mild. If it's between 15 to 29, it's moderate. If it's more than 30, then it's severe sleep apnea syndrome.
So there are patients that are stopping breathing more than 30 times a night?
Yes, it could be 30 times to we have seen patients who stop breathing or breathe shallow up to 100 times per sleep hour.
All right. Well, unfortunately, that's all the time we have, but I want to thank our guests, Dave McKnight and Dr. Shamsul Hasan, for joining us today on Speaking of Health, a great topic.
Thank you.
And have a great day, everyone, and be healthy.